A patient today came into the office stating that they needed treatment for new onset depression. When I asked about their symptoms, they stated that for as long as they could remember, they've always been a rather anxious person, worrying most days of the week, if not all days of the week, about all kinds of things, whether it be relationships, their family, worrying about getting sick, finances. And recently, their stressors had really increased in the last several weeks, and they started to feel just exhausted. They were getting poor sleep. They were having difficulty being present in the moment. They stopped enjoying being around family or friends, and they just felt really exhausted. What we talked about was, in this case, in an individual with no history of a mood disorder, but long-standing anxiety, that what might actually be happening is that this anxiety, that the problem was actually a primary anxiety disorder called generalized anxiety disorder, and that because stressors had increased to a certain point, that anxiety had just become so overwhelming that they were then feeling exhausted and tired and sad. And that this was what you would call a normal reaction to a difficult situation, and that situation being a significant anxiety and untreated anxiety. And so we talked about treatment of generalized anxiety disorder, and we talked about how this was unlikely to be a new onset mood disorder, but that's certainly something that we will reevaluate as we go with treatment. Luckily, we talked about treatments for generalized anxiety disorder that were non-controlled, that didn't have abuse potential, and that also treated depression. And so we're hopeful that this individual will be feeling better soon. Frankly, whether or not this is a primary anxiety disorder, which I think that it is, or if it actually is major depressive disorder.